And just going to share my screen while we're at it.
Yep. And then I think it's 12:01, so we're good to go.
Okay, great. Awesome. You want me to take it from here?
Yeah, why don't you?
Hi, everybody.
Yep.
Good morning and happy to be with you. Hope you're having a good start to the week. I also can't believe it's June 1st. Today we're going to talk about visitation mostly, since testing and PPE took a big part of last Thursday. And I want to thank everybody that participated on that call as well. Really, obviously, there's been two themes. There's many themes, but two themes from families have been about visitation and have been about testing. And I think with the testing one, we were able to dig a little deeper together last Thursday. And any of you that didn't hear that, please go online and you can catch our videos or replays of that on the web. So I'm going to spend most of the time. I have no guests, so people feel free to raise issues, questions. I'd say the three biggest issues, besides just getting through the COVID, from families and people with disabilities, have been the fear of healthcare early on and what would happen. And if we have time, I will drop a dime on the CDC and something that I've asked our national office to work on. Well, I'll drop a dime on it now. It's sort of shocked. Centers for Disease Control released something on, coverings for direct service providers. And it was somewhere last week they released it. I didn't look at it till over the weekend, but colleagues of mine had. And they had told me about a couple of updates. Well, the irony was, one of the updates is if you're really working closely with people, whether you're a parent or a sibling or staff person, and they, you're going to run into bodily fluids because you're doing personal care, and whether they can or can't wear a mask. Cloth coverings are probably not ideal for those situations. They're great for you and me in average situations, but and as a rule, they're great. But what was ironic about this, as I went through the CDC guidance, they were pushing cloth coverings for everyone, all staff, which again, it's fine as a general rule. But then when you dig deeper in their recommendations, a couple of links down the road, they said the reason they weren't recommending the other tools, which is surgical masks and N95s, was because they're being reserved for healthcare providers and first responders. And it struck me they don't realize some of our folks, our staff, our family members are in fact working in close quarters as our healthcare providers. So again, something in our world, wider world, that requires advocacy and education, hopefully just education. Hopefully this will get resolved in a few days and they'll update that, that posting. But if someone is not really engaged, it's really easy to miss that mistake or miss that lack of knowledge on the CDC's part. And in fact, honestly, if I hadn't been talking with so many people, I might have missed it. Okay, and I'm someone who works day in, day out in this field. So I just want to raise that even as we go through all these things, there's biases, there's issues that aren't even purposeful, sometimes lack of education. Anyway, we've all been through a rough week after Mr. Floyd's death, or killing, I should say, in Minnesota. We've all seen, how bias, exists in other places as well, and around racial and ethnic identities. And so it's really something to stay focused during a time like this, but we need to, and we also, need to worry about others in our world as well. On the COVID-19 numbers, I don't know what will happen after large gatherings of people in the protests, but right now, there was fewer tests. I don't know how much that had to do with the Memorial Day weekend. There was about half the tests done in the state between 5/26 and June 1st than, when I previously reported, which was sort of half a week ago. So my numbers aren't clean by a week, because I think I gave you a report on Thursday or Wednesday on the numbers, if I recall, Wednesday to Wednesday. The total number of cases only rose by 2241, but remember, there's half the tests. So we got to take that into account. And then, but the really, great news is that deaths, which are reported no matter what, maybe a little bit of a delay, but we don't have to subject that to a half number, was 232 versus 535 deaths. You can see I did a typo there on the chart, sorry. So I think that's phenomenal, and clearly that's a very good sign in terms of people's lives, which we care about. If we have some time, I'll show you, they did start posting on the web. We posted the fact that they are posting congregate numbers on the web. And just as we take a future lens, we're still working on some of the things we've already identified with you in previous sessions, but there are reopening challenges that are going to be happening. Keeping 2 settings open at once, adults and youth, school, day programs, employment services. People will phase in, so that means double duty. And for you families, what should be there is also the fact that some family members might have to return to work to a physical location while your schools are not open, while your day programs are not open. So that's going to be something we'll add on the future lens. I was trying to keep my what do you call it down, my slides down so we could get to visitation. Social distance challenges in all settings, going to continue to be a challenge. It has been a challenge in homes, but it's going to be a challenge now in day settings, school settings, assuming extended school year settings open, along with day programs. And then there's still going to be a need. The PPE, we heard from Gene Phelps last week what impact it made. I just talked to a colleague this morning, and he had a house that was tested. Everybody was negative except for 2 people with disabilities living in the home. And now when I say everybody who worked in that house for weeks was tested. No one refused, none of that. And all they could figure out was a healthcare provider. One of the individuals has a significant health issue that's at the end stage. And they're assuming, they obviously phoned them, that they brought that virus into the setting. But again, they wear a lot of PPE. They're very careful about their approach. And so this is, wow, it's and hopefully they'll do some retesting there soon if the state will allow it at the house where they were so recently tested. But it's really something, again, to think about. Addressing the state budget deficit, helping families at home, obviously, given the slowness of the phase back, reopening, and then finally continuing healthcare education, which I gave you just the example of the CDC advisory, or one part of it. And hopefully that's the only flaw. I have to go through them again. I'm pretty sure that's the only flaw we picked up. And then where is the 4th stimulus? We really need another stimulus for sure. So I'm going to skip over that. So we're at visiting, jumped right to it. And what I was thinking of doing, and was walking through a proposed draft we're working on to encourage visitation, getting your reactions to it. I think that makes sense. And it'll allow us for plenty of dialogue. I liked our discussion. I'd like a discussion approach, and get feedback from folks on here. So I also want to point out, you can give input to DDS, Department of Development Services, through that link, that form. I really encourage you to do it, whether it's, I don't care what the topic is, but especially about this topic, if you're feeling passionately about it, which I don't know, one person I've talked to who isn't feeling passionate about this issue. So some families have been visiting, sort of been uneven. I even had another colleague tell me over the weekend, yeah, we're trying to be fair, because they've been allowing some visits at a social distance, but they don't publicize it. And now, they're thinking of a pilot strategy. They don't want to, they're not trying to disobey orders or anything. They're just testing different strategies out, is the way they're looking at it. But others have not had the opportunity. And we talked with Brittany McDermott last Wednesday, and really dedicated staff person, very hardworking, great team. And the people she supports have been doing pretty well now, but they don't have any plans for it at that point. But they might be a different story this week, though. It's my hunch as people start to think about the reopening. So what I thought we'd do is walk through a little bit of something that Kerry worked on, and got some reactions from Maura Sullivan and minimal reactions from me. And I'm sorry the font's small because I was rushing to post this today to get it ready for today. But bottom line, the first section just lays out the issue, which is, families are overwhelmingly the primary and often the major source of support for their family member with intellectual developmental disabilities, including autism. And that's just reality. And even after, and I know there's exceptions to that, but let's just be real. And even when you look at the numbers, people in residential, people not, they're still often the major caregiver. But even for people who move into other settings, whether they're staff supported completely or staff supported partially, family members often, predominantly, maintain close connections. And for most, family engagement is the foundation for individuals with disabilities to live good lives. There's been the culture, the upbringing, all the things that the person sort of springs off of to be an adult, often comes from that nucleus and the community around him and her. So, and basically the definition of who the family is determined by the individual in word or action, and typically their parents and siblings. I'm not telling you anything new or rocket science here, but the term should be inclusive because it could include cousins. A friend of mine, her son, at least quarterly visits cousins, and he's, I think, in his 50s. It's wonderful. They continue long relationship, other relatives, aunts, uncles, childhood friends, or others they may have a special relationship with. Either, it could be boyfriend, girlfriend, could be, that sounds like a silly word to use for adults, but it could be someone they met at work 20 years ago and have been friends ever since. And of course, what families do, even whether in their own home or even if living in a residence, they're often very much an advocate, caregiver in some ways, medical liaison, to much, much more. So during this pandemic, it's really important for us to make sure that organizations work with individuals and families, that it's a shared sort of process together, shared collaboration, and keep the communication lines open. Because of the crisis, clearly communication's been more difficult than at other times. But, I've seen some agencies do both chapter and non-chapter, do some awesome communication stuff. So it's been great what I've seen. But in other cases, it's been weaker. So it's imperative at DDS. And one of the suggestions we're saying is make a task force. And maybe it could be a 1-meeting task force to look at proposals, 2-meeting, because, really, with the reopening, to take a look at best practice, guidance, and training for direct care support staff and families. And that as part of this reopening, we should develop a visitation rules and policy that can help guide providers. And so, again, this is a draft. It's draft number 2. So, and then here are recommended practices that I'm going to share with you for agencies. As an agency, in fact, let me do something here. I'm going to move this thing over a little, okay? Because I can't see. All right, I'm going to make it even smaller for me. As an agency, communicate. So first, there's general recommendations, which we've talked about over the past several weeks, and that's communicate frequently with family members and other stakeholders. Weekly check-ins by newsletter, email, social media posts, conference calls will keep people informed. Hopefully every single agency is doing this by now. Include what is happening in the organizations, issues being dealt with, spotlight on DSPs, direct support professionals, and suggestions on how families can help support and assist. Offer weekly communication by phone, Skype, FaceTime, or Zoom from staff regarding their family members. So in other words, separate from that, let's make sure there's some kind of process that's regular communication. And then if someone has COVID positive in the house, have even more than weekly communication, right? People are wondering, hey, what's going on? What's happening? And you can do that with an email list group, or you can do it with a group call. Hey, we're going to do 2 calls a week to just keep you abreast of what we're working on. And obviously you can email in between. It's pretty easy to set up an email list. And then offer and support communication between the family member and the individual multiple times during the week as desired. And you say, wow, isn't that taxing? I hope not. I mean, why would it be taxing? People are home most of the time. Maybe they are doing some group outings, but I would think that could be one of the ways that we can personalize, life during COVID. I know at this point, there's been clearly weekly communication, going on. And I know in some cases, the weekly communication hasn't been great as time went on, depending upon the nature of the disability. And here are some of the suggestions in terms of the visitation or opportunities that we think make sense. So as part of the recommendations, schedule visits in the backyard and porch. Visitors should maintain social distancing and face coverings. And I think a couple of places have already started that. I'm not sure. Again, because it's sort of not in the general policy frame. I think if they've done it as a pilot to test how it would work. Consider walks around the block, either together with the staff person or just individual and family. And obviously the governors encourage physical activity outdoors. And that, I know that's been happening in some cases right from the start. And sometimes, you may not need to have staff involved, right? If people can be trusted to keep the social distance. But, that might be more for the backyard and porch as opposed to the walk. Now, this one I like that Carrie came up with. If individuals are going on a community trip, invite families to join them at the destination with recommended precautions. Hey, do you want to meet us at X? We're going to be going together to this pond just to stretch now that it's good weather. And it would be good to know who's going to be there and who's not so that people could be prepared in advance. And then, of course, she is the next bullet. Prepare individuals with the expectations of visit. What are the limitations? What can they expect? And prepare social stories for persons with disabilities to illustrate what they should expect. Anticipate emotional moments. Have a plan if the visit does not go well, how to end it and problem solve for future visits. I mean, this is a good person-centered strategy, right? You figure out if somebody can't do that, how do you figure it out so there can be at least some kind of visit? And maybe that's part of their growth as an individual is, they have a tough time with this kind of visit, but we're going to figure it out. We're going to figure it out over time. And everyone still has clinicians working with them. They can help advise on a person-centered approach to this. And then work with the individual and family so that special occasions, such as birthday, can continue to be special. Now, it would have been nice if we put this out before Mother's Day, right? As I saw a couple of Mother's Day Facebook posts about, and also from a friend for 25, 30 years who said it was the first Mother's Day she was without her son in a very long time, and I don't know if it's 45 years, 50 years, but it's that long. So that was tough, right? And then if entry into the home is considered, which I think some people will do, down the road, depending on the house and the ability to handle that, use the same screening as staff undergo. Oops, hold on, sorry, I got ahead of me. So that's the sort of framework we're thinking of and would love to get your reactions to that and your, pros and cons, and feel free to type them into the chat as well. So we'll have a record because then we can download it from the chat. And I think, Carrie, you're going to help me with the chat, right?
Yes, we do have a question. Has anyone seen, this is from Nina, has anyone seen guidance for working with students where 6 feet social distancing cannot be followed, such as one-to-one, feeding, toileting? Wondering what staff are doing.
Wow, so clearly staff are helping people in the homes, doing that. And that's why the CDC guidance was so inappropriate. I can tell you that in the big purchasing that happened in Massachusetts, and I will put the link into the chat in a minute. Oh, Carrie already did it. Thank you, Carrie.
I already did, but Christine told me the link goes to a broken page.
Then I'll double check.
Yeah, we'll check it out. Yeah, we'll get it.
Before the end, we'll check it out. I'll stop sharing the screen in a minute and take a look too. So maybe I didn't put the full thing in there. But back to the point about staff. So people ordered glass shields even in some cases, knowing that staff would be working with people who had the virus, right? A person living in the home, and that person living in the home may not be able to wear a mask or tolerate wearing a mask. And again, the surgical masks, the N95, KN95 is the cheaper version of an N95 mask. So that's there is no way around that. Okay, just to be clear. I mean, if you're helping someone physically, there's going to be no social distancing involved. And then Gene Clapper wrote, Carrie, about that Charles River Center provided social distance outdoor. Is that what I'm seeing?
Yep. The Charles River Center provided guidance around social distance outdoor visits last week, which is great. That's progress. Okay, then Lucia was wondering, has there been any exceptions to enter the homes for new transitions into new homes?
So there has been very little movement into homes. I got a feeling it's going to be more often. And by the way, I just put in the full link. Carrie had gotten the top of the link. That's why you had a broken link.
Okay.
So there has been some transition. It's been very specific transitions. And, they've been carefully thought of. I remember early on, so some folks had called me that were the head of agencies, 2 people, not a lot of people, were feeling pressured for placements, and it was the height of the virus, and they were concerned that they needed to have a test before the person came in, and they realized the test would be 100% because 3 days would have gone by, right, since getting the test. But they're willing to consider the person, at that point. So now I think it'll start to step up, but I think also people probably are struggling with having sons and daughters go home and as well. I know with some agencies, no one's taken their family member home. Other agencies, they have. But there are openings across the state in terms of, and then turning 22, transition is a big deal as we look over this year. Carrie, back to you.
Okay, great. We got it. The link, the complete link is in the chat box. Okay, so Christine says, my son's agency has started outdoor visits. Masked clinicians circulated around backyards to check in real time to see how things were going. Very helpful, as well as the direct care staff who are available in the house to be called upon. That's nice. That's good when everybody's working together. Cynthia has a question. She's been suggesting the backyard visits with extreme precaution to also walks with my son, and the agency will not allow. Also, my son will not understand why he can't touch or hug us. He has low functioning level. He and I are, his dad and I are very involved in his care, everyday contact, take him out every week, plus overnight visits. Now we have nothing. It's breaking our hearts. My son does not know what's going on and is not receptive to FaceTime, even though staff and I try every single night. What happens if the agency is one person that is somewhat medically fragile and the other clients are not?
So that's, sort of like a couple of different themes in that one, right? I would say with the hugging and the touching, I think that's what calls for a person-centered plan to work through with the agency. Are they open, to working through a plan? And it sounds like they're not at the moment. Is that because they're feeling like they had a tough run with the virus? It would be good to have some communication. I think Carrie's, talking about the communication piece. It's good to help to have a dialogue. I don't know how long, if you've had a long conversation about it, or if you find, you start advocating and they get, hold a hard line, in response, instead of saying, can we just talk about this? Can we just talk about our different needs? Can we put that, let's list them, we really want to have this connection. We're not sure how healthy it is for our son to not have this connection. You're worried about the virus being spread in your house, but you have staff coming in and out of your house as well. So what could we do to have a compromise around this? Realizing that, there might be a hug involved. and or we tell, we not allow the hug and just work through a number of weeks his frustration with not being able to hug. And this is where a clinician can be helpful. This is where also communication and dialogue can be helpful. The other question, I'm really not sure in terms of someone with a medical and no one else has a medical. I don't know if that means they're being extra careful. So you might have to give me more background on that. Can I go back to the issue with, I think Mike asked about the task force. There is no task force yet. We're asking that there be a group to meet on this. And I don't think it's a rocket science thing. I think it's about some providers, family stakeholders, and DDS getting together and thinking through the issues around visitation together and coming up with a compromise. So we don't have, sounds like right now in this dialogue, we have 4 different examples, 4 different scenarios, 2 of them actually similar, right? Allowing visits of some sort and pretty good. One, not allowing at all, right? So it sounds like, wouldn't it be great to develop some consistency around this so that people aren't frustrated, but also so we maximize the connections with family. Carrie, you look at yeah.
Yeah, so Cindy had a follow-up that they had no clients with the virus. Then she advocates every week with emails, but they don't listen. And he needs to see us for his well-being. Staff are going in and out of the house. Why can't families? And Rosalie suggested for your situation, Cynthia, says, why can't they make arrangements for the parents to get tested and then they can visit and potentially get a hug? Certainly if their son is a hugger, he's out hugging staff, so why not the parents if they're not carrying COVID? Good point.
Yeah, and I guess, one of the dialogue, that's one way to go, exactly. And the other way is to help him understand over time, repeated visits, that the hugging's not going to happen for now, but I agree, if there was testing maximally on demand available, I totally get it. I think this is why we need to have some kind of group response. In terms of email, Cynthia, I would go beyond email and I'd ask for a phone appointment with the director of residential. And I'm not sure, if he's in a vendor situation or state operated situation, but I would go ahead. I also thought, and I'm not sure this is true, with the pop-up sites, it'd be interesting to see if parents could show up at a pop-up site that DDS has. That could be one of the questions we ask, and we will this week. But, we'd love to have, what do people think about the recommendations that we put out there? And what are, before we end up out of time, I just want to see if there's any feedback on that. And by the way,
Jossie said,
yeah, go ahead.
Oh, sorry, Leo. Jossie said, if the staff can touch the residents, why can't their family? And Alice has a question about, we had to cancel our annual late May physical because group home agency would not transport him and would not let me do it. Who knows when it can be rescheduled? We book it a year in advance. House is not in quarantine, and telehealth is not a good substitute in this situation.
Right. Totally, Alice, totally agree with you. And that was, I assume this just past few weeks or, yeah, okay. Yeah, you're shaking your head up and down. So yeah, so it's a shame. I think we, sounds like we really do need a really very short-term task force regarding this and to get it together and get some solutions so we're not spinning our wheels. And I think sometimes on the restrictions, it really is about people being nervous about the touching. And if there was more testing, we wouldn't be probably having this question. And then someone else, Cynthia, just said doctors are refusing to see your son because he won't.
Yes.
Oh my God, that's sort of crazy.
Yeah, that's not the first time I've heard this. That's
wow.
Yeah, definitely. So, yeah. So Jean had a question about what about the task force regarding reporting data, H4672. I thought this task force would also be addressing disparities for people with disabilities. I believe an initial report is due out today with a final report by August 1st. Do we know who these task force members are? I'd like to contact them to provide some input.
Let's follow up with you. I know on the original bill, I think Maura and I were talking about this the other day, right? That's the bill that had an amendment to it that didn't originally include our constituents. Right? Is that, if I'm getting that right? And I don't, you know what, I can't access it right now because I'm sharing my screen.
Yeah. Jean says yes.
Yeah, let us follow up on it. You know, and I actually thought to some extent it was still in play. So you're ahead of me. Because I was reviewing the bill and I feel like it was just last week when we were talking about it. You know, for those of you, am I still sharing my screen or not?
Yes.
Okay, so I just went, let's see if I can share this. Are you seeing a website?
No.
Okay, let me go into it and hit stop share and hit share screen again and find it. Here it is. You guys see this now? So here's some data. By the way, if you go up a page, you're looking at the big settings, right? And then you go down a page. And so to me, you know, this is from, I haven't refreshed. Maybe I should refresh the page because maybe, is there a refresh thing here? This is a couple, I've had this open since the weekend. So here's from a very, DDS has been the most tested agency among these agencies. So you should know that. I was told there was 15,000 at least tested, and someone told me today it's probably gone higher than that by now, because I was given that number last week. And total tested, if you go to the state site, let me see if I have the state site open. No, that's
to
not.
refresh, try the curly cube by the web address. I think that's refresh.
Okay.
This little curly cube
On the right?
on the yeah, on
What
the
if
right.
I do this? What if I just did?
There's an address and there's there's a little
How's that?
curly cube. Yeah.
I just returned. Okay. So it's still the same. Okay. So just so you know, so I went onto the state site to look at their testing. There's, you know, COVID-19 Command Center. And I'm dying to pull it up because I have to tell you, I could have swore it was like 17, 18, 19,000 tests for congregate care settings and of people. And I will add it. Don't send the PDF, Kerry, until I add that to the PDF.
Okay.
Okay.
Alrighty.
Site and the number. So if it's true, if my memory's correct, we have like a ridiculous percentage of the testing. Okay. So of course, you know, if you look at the client cases at DDS, there was 155 of 1,000 something people, you know, 1,061 people in the state operated homes that were COVID positive. And there were 1,185 out of 7,840 in the provider run homes. And altogether there was 75 deaths, which they haven't broken up into groups. So when I looked at that by itself, it felt like, oh, wow, we didn't get totally burned, but it's still 75 out of 9,000 people, which one of a parent advocate said to me, that's, you know, less than 1%. It's better than the public average. But the Disability Law Center, to their credit, is looking into the deaths so they can see, you know, what was, you know, how did they happen? What are the ages of the people, you know, just different circumstances. And I think that's probably a good thing because, not probably, it is a good thing, there's no probably about it, because it's going to give us information about our folks that are served, constituents, that perhaps there could be better safeguards in place in the future, despite the number not being a scourge. You know, and then you look down the page though, and you look at DMH, which also serves adults, and you have a lower number of people with the virus and a lower number of people who died. But again, fewer people tested. I'm not sure how good their number tracking is compared to DDS. But I do know they have far fewer people tested. So I'm not sure what their age clientele is. Are there people being served who are in their 60s, 70s, in the DMH system? Or are we talking people in their 30s, 40s, and 50s? And I think that I'm just not in touch as I was 20 years ago with those kinds of numbers. So, so it's great from my perspective. And knowing that we have people who do have complex medical conditions. There's also an article I came across that looked at statistics through May across the country, and we can share that link as well, that talks about the comorbidity because of, meaning other medical conditions that people with, whether it's autism, intellectual disabilities like Down syndrome, cerebral palsy, other conditions that people have that, help make them more at risk during the COVID virus. So I just want to touch on that as well, because Jean brought up the data piece. Look,
Okay, thank you.
Yeah, I'd love for you.
So we're running over, but it seems like there's one more question, suggestion for Christine and Kathy, that her son tested positive early on, and it was believed he picked it up from a staff member. Can we get screened by temperature checks, just like staff are? But then Christine says that she does telehealth, and everyone that she talks to who had COVID, only one had a temperature out of about 30. So, but to address that, when we do reopen, what kind of screening is being recommended?
So that's what they're working, one of the subcommittees between the trade organization, ADDP, and the Department of Health Services is infection control, which will develop some procedures around screening. So they're meeting this week, the subcommittee, and, I'm looking forward to keep being updated on how that's going. So there's a lot around it. There's several subcommittees. All of them are meeting this week. They're going to gather the information. Then there's a coordinating committee to sort of go through that. But we do know people are going to go back in phases. We know there's going to be social distancing. And we know it's going to be a process where there's going to be a combination of people staying at home while people start their day and employment services. And anyone who could be employed, I think, that had jobs, they're going to try to figure out a way to get them to their jobs and make sure the businesses where they're going to have, check-in process as, different kinds of checks. And great point about the temperature. There's a lot of people who are COVID positive. Jean Phelps shared with us last week that only 2 of the people of the 30-something, 34, 35, actually had symptoms. Okay, so, and they all had positive. So it's really important to remember that. And the 10 to 14 days, depending upon, who you are, because that's the 2 ranges of time are really important, the quarantine period. So, so I'm going to suggest for all of you to use that link to say you really want to do it. In Cynthia's case, I'm going to ask you to reach out and for a phone call with the program director, the residential director, and you can also contact your area office. And I would start with your service coordinator, but I wouldn't hesitate to contact your area director or assistant area director, and just say, look, I'm willing to compromise. Let's have a discussion here of how we go from here. All right, and anyone in that situation where I really encourage you to do that. Use the form, it's set up. I also, just in closing, want to encourage you to send in feedback as well to us, react to the draft that you're going to see. If you have other recommendations, feel free to send them to Kerry Mahoney. And I hope you all have an awesome week. And thank you for engaging with us today on this important topic.
Thank you.
Thanks, Leo. Thanks, everyone.
Thanks, Kerry. Thanks, Leo. Thanks for listening to all my questions.
Our pleasure.